In this video, I want to highlight how different age groups are affected by COVID-19 in Iowa and what groups should be protected the most during the pandemic. Almost all Iowans are at risk for contracting SARS-CoV-2 simply due to the fact that, at the time of this recording, only 33,251 Iowans have become confirmed positives, have cleared the virus, and/or have died from the subsequent disease called COVID-19. While all of us are at equal risk for contracting the virus due to our immune systems never having encountered it before, certain age groups are at increased risk for a variety of factors. Early in the pandemic, middle-aged Iowans were the ones who were predominantly contracting the virus. This was likely due to many frontline workers being deemed essential, whereas in April, both adults and middle-aged adults were the prime vectors of infection. Now that we're in July, adults and primary college-aged adults are the ones contracting the infection. As we can see with recoveries, the distribution by age group matches closely with distributions of positives by age group. Unlike with positives and recoveries, deaths have been predominantly skewed toward older and elderly Iowans. This is due to a variety of factors, but centers on the risks of pre-existing conditions like cardiopulmonary issues, diabetes, all-cause dementia, and COPD, decreased immune function due to age, and external factors such as living in long-term care facilities. Before I get into specifics about the different age groups, I want to discuss how I arrived at the infection fatality rates for each group. Since Iowa thankfully hasn't experienced massive casualties to COVID-19 thus far, namely nothing in the range of thousands or more dead, I didn't want to base my calculations on the death distribution, especially since we have rather incomplete data for deaths of Iowans under 60. The sample size isn't large enough to make reliable projections. Therefore, I am relying on case fatality rates by age group from Oxford University via Our World in Data and the CDC. I cross-checked these values against the World Health Organization and the percentages of each group of deceased Iowans against their respective closed cases, which is the total of all recoveries and deaths in each age group. Infection fatality rates may change in the future as we gather more information about how the pandemic causes negative outcomes among Iowans. Kids and teens in the 0 to 17 age group have comprised between 1.64% and 5.08% of positives in the pandemic thus far. This group has seen an increase in positives in the last month, especially since the state reopened at the end of May. With schools formulating plans for reopening in August, it is probable that kids and teens will either maintain or increase their share of the distribution of positives in Iowa. In order to protect our children as much as possible, kids should be educated about proper mask usage, good hand hygiene, and social distancing at least 6 feet per CDC guidance, and preferably 33 feet to protect themselves against aerosolized particulate matter sneezed by another kid or adult. I project that out of 100,000 positives, kids and teens should comprise approximately 5,000 positives and should not have more than 5 deaths. I am praying that no kids or teens die from COVID-19. I have set the current infection fatality rate for kids and teens at 0.1%. Adults in the 18 to 40 age group have comprised between 27.05% and 48.08% of positives. This group has become the predominant driver of community spread in Iowa over the last month. I believe this group should be divided into 2 subgroups since collegiate adults are behaviorally different than 30-somethings. College students experience more heterogeneous mixing than people in their 30s, simply due to the lifestyle of college students living both on and off campus. I project that out of 100,000 positives, adults should comprise approximately 48,000 positives and should not have more than 125 deaths. I set the current infection fatality rate for adults at 0.26%. Middle-aged adults in the 41 to 60 age group have comprised between 30.78% and 35.5% of positives. This group has had a steadily decreasing share of positives since the end of March. While this group was the original driver of community spread, middle-aged adults have, based on data, avoided heterogeneous mixing and followed CDC guidelines. I project that out of 100,000 positives, middle-aged adults should comprise approximately 31,000 positives and should not have more than 265 deaths. I set the current infection fatality rate for middle-aged adults at 0.85%. Older adults in the 61 to 80 age group have comprised between 12.11% and 30.05% of positives. Like middle-aged adults, older adults have steadily and considerably decreased their share of positives. This is likely due to research showing that adults over 60 are at an increased risk of severe disease and death if they were to contract COVID-19. I project that out of 100,000 positives, older adults should comprise approximately 12,000 positives and should not have more than 990 deaths. I set the current infection fatality rate for older adults at 8.20%. Elderly adults in the 81 and up age group have comprised between 3.94% and 6.01% of positives. Like middle age and older adults, elderly adults have decreased their share of COVID-19 positives in Iowa. This is due to long-term care facilities quickly instituting infection control protocols and locking down facilities so as to keep their residents as safe as possible. There have been 63 long-term care facility outbreaks since the beginning of the pandemic as of the filming of this video. The elderly are at a greatly increased risk of severe disease and death, so minimizing infection exposure is critical for all Iowans over 81 years old. I project that out of 100,000 positives, elderly adults should comprise approximately 3,900 positives and should not have more than 800 deaths. I set the current infection fatality rate for elderly adults at 20.20%. In the next video, I will discuss the interaction between COVID-19 and biological sex here in Iowa.